Hi, I'm Dr. Ako. I'm a family medicine physician in Texas. I'm here to talk to you about a blood pressure logbook and a medical record book that I created. This logbook was created out of a need that I saw in clinic with my patients. My patients with hypertension or high blood pressure are usually required to keep a log of their blood pressure and their pulses and what times of the day the blood pressure and the pulse is being recorded. And my patients usually will receive a paper from clinic to record their blood pressure and their pulse. And a lot of times, patients will forget these papers at home. And even if they did remember, they would bring it, this month, forget it next month. So there was no consistent way of tracking blood pressures and, pulses. So I decided to go ahead and create this logbook to help with that need. The logbook has been combined with the medical record book because I also felt like patients actually do need to record their medical, surgical, allergy, medication histories, any important events that happen, take notes in clinic when they're talking with their doctors, or take notes at home too about any events like, a low blood pressure or a low pulse rate, and, record what they were doing at that time. So I felt it was essential to create this blood pressure logbook and have, a designated area where they could record some of these events. So I'm going to start by showing you what this, blood pressure logbook and medical record book looks like. Okay, so on the cover page, I've included a free ebook on hypertension. So it helps you understand what hypertension is, what some of the, adverse effects of not taking care of your blood pressure are, like a stroke, a heart attack, blindness, kidney damage. And on the very first page of the logbook are instructions on how to properly take your blood pressure, things like, uncrossing your legs and having your, monitor at heart level. That way, the readings that you're posting are actually accurate. And then the very next page goes into hypertension and all, the comorbidities that go with it. Okay. And then the very next page, we're getting right into the medical record book. I know this medical record book is really good, especially for elderly patients who are beginning to forget, their medical history. So this would be a good place to record all of that. It starts with the medical history, the surgical procedure history. And then it goes through, social history, medications, allergies, family history. And on this page, actually, I did add, the primary care physician's name, office number, the, nephrologist, because sometimes, patients with hypertension or high blood pressure do develop some chronic kidney disease, as well as an annual eye exam, and your ophthalmologist. Okay. On the very next page is an additional section where if you have more providers, you can fill out their, information here. The logbook starts in the month of January of 2025, and the calendar is already included in the book. So you don't have to even figure out what day it is. It's all here. All you need to do is record your blood pressure and your pulse. I have put some numbers up here as a point of reference. Whenever we're checking blood pressure in clinic, we're checking a systolic blood pressure, which is the top number. We're checking a diastolic blood pressure, the bottom number. All right, and then we're also that blood pressure usually is around 120/80. It's not the same goal for all patients. For younger patients, it is. As people start to get older, we're more lenient about, the goal for blood pressure. That number tends to be a little bit higher. And for people who have issues with syncope or lightheadedness, that number is usually, the goal for them is usually a little bit different. When it comes to the pulse, normal pulse usually runs between 50 and 100. But again, this is not a, one number fits everybody sort of thing. This is, it depends on your medical history. It depends on your other, medical conditions. It depends on symptoms you get with blood pressure medicines. Some people do become bradycardic. Their pulses drop on certain medications. So all of this has to be tailored with your physician or provider. I'm just providing a reference range so you have an idea of where these numbers should be. The other thing that is usually recommended is that when you check your blood pressure at different times of the day. You can check it in the morning, you can check it in the afternoon, you can check it in the evening. Sometimes you want to check it at different times on different days. And when you do check it, always make sure you have a pulse, a corresponding pulse with the blood pressure, and just write down what time of the day that blood pressure was taken. If the blood pressure appears to be low or high, you can also go ahead and document whether you had taken your blood pressure medicine at that point, whether you were dehydrated or had vomiting or diarrhea, whatever the case may be. Just, put some notes in there, as those notes will be useful when you see your provider. The logbook goes from January of 2025 to January of 2026, and it goes, it follows an order. It goes, from week 1 to week 4. Every month, there's an additional page called a note page. And so you can, record any additional events that you're not able to fit on the logbook page itself. Okay, there is a place where you can record your weight as well. And this concludes my review of the blood pressure logbook and the medical record book. Okay, there is more information on the back of the book. I did put my website here. If you're wanting more information or you're trying to keep up with what I'm doing right now, you can go to my website. It's quarantineacomd.com. Thank you.